Hey, what's up, y'all? Welcome back to the Operation Miss podcast. I'm one of your co hosts, Jessica Thompson. We have Catherine here, your other co host. How are you, Catherine?
I am doing great. How are you?
I'm wonderful. And y'all know we always have a special guest. And today we have Tabria with us. How are you, Tabria?
I'm doing well. I'm so grateful that you all chose me to be the special guest for today. So thank you so much.
We
Girl.
are so thankful that you agreed, okay? Because we love to talk and we know you have so much knowledge to share with us. I'll let Catherine introduce you to all the listeners.
Okay.
Yes. So I am weird. Okay, so about a month ago, maybe, or month and a half, we were introduced to you because you were having an amazing event in Statesboro. And we are so grateful that you decided to include us in that event. So just for all of our listeners, that's how we initially got introduced to Tabria. And it has just been month and a half of falling in love ever since. And it culminated on last Saturday in Statesboro, where we were able to together serve moms because of the love, devotion, commitment, and planning that you put into it, Tabria. So thank you for what you did then, but even more, thank you for what you always do for moms, because we know that we see just a snippet of it on the day of an event, but we know that so much has gone into it, not just to plan that event, but for you to serve moms on a day-to-day basis like you do. So without further ado, we want you to introduce yourself to the listeners and then maybe talk with us about the genesis of the Mocha Moms event that you put on Saturday.
Yeah, sure. So I am Tabria Corprew. I am a licensed professional counselor, certified professional counselor supervisor in the state of Georgia and Florida. I am trained in perinatal mental health. And so a large piece of what I do is to serve that population. I also specialize in treating women of color. And I should probably also announce that I am in private practice. I'm in a solo private practice called Compassionate Counseling and Support Services.
Yes.
So I offer therapy support to women of color. I don't limit my services, but I mostly cater to women of color and women who are requesting emotional support before, during, or after pregnancy or a loss. Most recently, I hosted an event called Mix and Mingle with Mocha Mamas. And the goal of the event was for me to connect providers of colors who worked in different aspects of prenatal care with women of color or moms of color in Bullitt County, which is Statesboro, Georgia, where I was born and raised. I thought that would be a good place to start since that's where I saw the first Mocha Mama. Um, and I wanted to make sure that we were to hit on a few different topics or a few different areas that would combat the Black maternal health crisis. I wanted to make sure that moms had resources, information, and tools to take on their prenatal care and just their overall health in general. And so that was a little bit about the goal of the event. It was set up in vendor style. I wanted to make sure that I that the moms who came in or the women that came in felt comfortable with the providers. I didn't want it to be like panel style where we were talking at them. I want it to be very collaborative in nature because that's how I feel healthcare should be. I
Amen.
feel it should not just be the provider telling you what should be done. I think that your prenatal care should be very collaborative. And so that was the environment that I wanted to cultivate, is very collaborative, very comfortable, and just very friendly, And so I also wanted it to be where the providers looked a lot like the moms. So that was Mix and Mingle with Mocha Mamas. That was year one, 2022. I'm hoping that I am able to host that around the state of Georgia each year. I don't know if you all are aware, but Georgia is the number one state that is at risk or has the highest maternal mortality rates. And so it's very important that we are able to connect with all of the moms of color and moms in general to provide these sorts of services and just to let them know that we're out here.
Jessica, I'm like, this is Superwoman right here on our podcast.
Yes, yes.
Wow. You
And
could
it's so
tell.
needed. And thank you for highlighting the poor maternal health rates in Georgia in particular, because it's a really big deal. And definitely what you did with your event was a way to kind of bridge those gaps and to let moms know, especially moms of color, because we're disproportionately affected by those negative statistics, just to show them that there are providers like you who are on your side and willing to serve you.
Yeah, definitely.
And I was just going to say, I love how you gave the description of how you came up with creating that atmosphere, because even as providers, we felt special. I mean, you know how to make someone feel special. And I feel like with women, sometimes that makes all the difference in the world. There were women who talked with us about things that I think if the atmosphere were not the way you said it, that we would never have been able to address their issues. So thank you for setting up the environment. We believe that in the body as well, what the environment is like matters. So that's why it matters what you eat and what you drink and how you sleep. And you have to create the environment, the best environment for a baby to thrive. So, but sometimes we don't know how to do that. Nobody tells us how to do that. So we're firm believers that you have to combine the advocacy with education and then the collaboration, making sure everybody who needs to be on the team is on the team. And that if we can do that, then we could make Georgia a little bit more safe to give birth.
Yeah, so, absolutely.
Yeah. So if you want to, we would love for you to talk with us about your birth experiences, because we know that you've had a couple. So please go ahead and jump into your story.
Yeah, absolutely. Thank you for allowing me to share this in this space. So I appreciate that. I have two children. The first child, his name is Jonah. He was a stillbirth, born at 27 weeks. And then the second child is Nova Grace, and she is a little girl. And so the first experience was not the best experience for me. I was a first time mom. I chose, I was already doing therapy services. So I wasn't, I wasn't like in college. I had resources. I had resources, I had education, I had knowledge, and information. And if I didn't have them, I had access to getting them or receiving them. I chose my provider, not really based on a lot of, I guess, necessarily good things. He was a male provider who was not of color, which was fine because at that point, it was just, I took him, he was close to my job. If I had appointments, it would be easily, I could easily assess the doctor's office, and everything was fine, no health concerns, no health conditions, no issues with Jonah at all. There was one weekend that I noticed he was not moving as much. And so I felt it was just stress, and I needed to maybe have something to eat or needed to drink something. And so I did. And then I still didn't feel anything. And so I just remember shaking him a little bit that morning. I decided to go into work because I had just had a baby shower at work. They threw me one, surprised me one, which was awesome. And then I was going to have one the upcoming week, a personal one. And so I just kind of shook him and I said, "Don't you scare me." And so when I got to work, I was a part of a mom group who had, we were all going to give birth January 2020. So I was a part of a group and I kind of something just told me, just asked like if other moms are experiencing this, and I just put in the group, hey, I haven't felt my baby move, in like a day now, and I'm 27 weeks, and so what do I do? And everybody is like, oh my gosh, like you need to call your doctor ASAP, like go to labor and delivery. And I'm like, okay. So I called my doctor, like the emergency line, because it was on a Saturday, and he was like, everything's probably fine. Just go to labor delivery, have them check and make sure everything is okay. And so I went to labor and delivery, and I just start bawling because, well, I went to the emergency room, but I start bawling because I knew something wasn't right. And I remember the receptionist saying, like, it's going to be okay. I'm sure he's fine. Just breathe. And to me, even that moment, it meant a lot for me because I knew that she was just trying to comfort me, but I knew that my baby was not well. Because of how the history of him moving, and I just could tell like he was kind of a very active baby. I went to labor and delivery. The Doppler, the nurse, she used the Doppler, and she was picking up my heartbeat. And so she just said, well, I don't want you to panic. She said, but I'm going to get an ultrasound technician to come and, check him out. And I said, okay. But I already knew, I already knew.
I'm sorry. Were you alone at this time? Were you by yourself?
I was by myself. I didn't want to tell my husband at that time. Because he would have had to travel, and I didn't think it was going to be healthy. So I was alone. My boss at that time, she was at work too. We didn't really work on Saturdays, but I was just coming to kind of brush up on a few notes and things like that. And she was there. So I had messaged her, and I just told her, I'll be right back. I'm just going to run to the hospital. And she was like, no problem. So fast forward back to when the ultrasound tech came in. She came in, and I asked her, is everything okay? And she said she couldn't share that information with me. And I said, okay. She said that but I knew that she was also very nervous because she knew that the baby was not alive. And so I could see on the ultrasound that he was not alive too. I could see that he was just there. And then 2 nurses came in, and the doctor at that time, and I heard him whisper, does she know? And I said, yeah, I do know. And I just lost it. And so that was like the worst time of my life at that time. And I'm getting a little bit emotional. So just bear with me. Because sometimes when we talk about things that are very traumatic, they can trigger us again. But anyways.
You take your time, Mama. We're crying with you.
The nurse, she just like walked me to the other room because I would have to give birth to him. And so she said, did you tell your husband? And I said, no, but I need to tell somebody. I texted my boss, and she was like, I'm on the way up there now. The nurse at that time, she texted my husband and just said, hey, can you come? And he and I never told him what was wrong. He just looked at me, and we just like lost it, So I gave vaginal birth to Jonah on October the 23rd, which is also my anniversary. Me and my husband got married on that day to honor Jonah. So I gave vaginal birth. A nurse and a student delivered Jonah. And the experience at the hospital was simply awful. And it was awful. And I'll just tell you a little bit about it. So first off, my doctor was nowhere in sight. I would have preferred that he was the one deliver Jonah, just because, like what's happening, like what happened. I'm not for sure how this came about, but everything was fine. I just wanted to be sure that everything was okay with me and try to figure out what happened with him. My doctor's explanation was, sometimes these things just happen. Sometimes they're not able to be explained. He like got the placenta, like it was like dripping all over the place. They spelled Jonah's name wrong on his like birth certificate or death certificate. I didn't have anything, so we didn't plan to have a baby. So I had like no backpack, no, diapers or anything. I asked, could I get diapers? They said no, that I could not get additional diapers at that time. We had family that wanted to come and visit, and it wasn't like a significant amount. It was just our immediate family, like my mom, my husband's mom, and our siblings, and they wouldn't allow them in. They were like being so nasty and rude to them. Um, so much to the point where one of the nurses actually filed a complaint for us, and like somebody came in and like spoke with us or whatever. But it was just awful. My doctor at that time just like had no remorse. It almost just felt like, your baby died, and I hope all is well, and whatever happens, happens. So it was really horrible. I had no education on like the postpartum piece of things and what it felt like to be dealing with postpartum grief, or like, like pregnancy grief and loss, or like postpartum depression, because I got very depressed during that time. There was no resources, no follow-ups. When I went to the doctor's office, to my OBGYN, when I followed up with him, he like was like, oh, I know I prescribed you this type of medication. I'm like, no, that's the wrong medication. So he like named out a totally different medication. It just was so, it felt like just dismissed, undervalued. It felt like there was no like aftercare plan. And like he didn't care to try to figure out what had happened.
Right.
Later on, I suspected what had happened. I did write the medical board, so I started therapy, and I felt like there was something that I had to do.
Yes.
And what I did was to put me at ease was to write the medical boards about the like the unequal care, or like just the like the dismissive nature of like the practice. It just felt so wrong. Like it felt so like, you're young, who cares, whatever. And like I said, I'd already at that point been educated. I had like a really good PPO insurance. You know, I didn't feel like I was like just, I dressed well. I spoke well. I just felt like I didn't understand why it almost felt like my pregnancy loss and my care just didn't matter. Well, fast forward to 6 months later, I got pregnant with Nova.
Wait, Tabria, can you go back for us for a minute?
Yeah.
For a couple of reasons. Number one, thank you for sharing your story.
Yeah,
we
sure.
we meet moms who have stories like yours, and it really breaks our hearts. And that's why we've been passionate about working with moms for a long time, long before we learned about the maternal health crisis. But what I'm realizing is the more we get into it, the more we realize that the statistics are right in front of us. Like, you know how sometimes you know about them, and if it's even in Georgia, but if you don't meet someone who's experienced it, it doesn't hit you the same way. Unfortunately, it doesn't hit me the same way as like every weekend now I'm meeting people, or people are calling us and telling us about it, or emailing us and asking if there is anything that can be done to help. And then we run into someone like you who it's happened to, and you're like, not only is it real, but I'm going to stop it from happening to other moms. And so thank you for not getting stuck in that grief and deciding that you were going to move forward and do something about it. That takes a lot of courage, and it takes a lot of reliving the trauma, like you said, but it's so that someone else doesn't have to experience that trauma, because it's not just the trauma of losing a precious baby, or people assuming that you're just a mother of one. Like you said, you're a mother of two, and that's language that needs to be corrected as well. And so you're bringing awareness to how loss can be dealt with in a more sensitive way. So thank you. I am curious, if you don't mind,
Yeah, sure.
how much time did you have to spend in the hospital after you delivered Jonah? And then what was the delivery process like? How do they get you to deliver that early?
So I'll answer the last question first. So they used Pitocin. So that jump started the labor process. They allowed it to happen more naturally, if that makes sense. But it did take a while. So I stayed a whole week. So, I said that Saturday, I found out, but it was the 19th, October the 19th on that Sunday, And I didn't discharge from the hospital until I believe that Thursday. So I stayed for a while, and it took a while for me to start to dilate and for him to come. And that was another kind of, I guess, scare or like, um, not necessarily a scare, but it was seemed very insensitive from my provider. He said that he would have to give me a cesarean section had the baby not come in like a timely manner. So I just thought that was the most insensitive thing to say to a mom who just lost. But also, like, I mean, I'm paying to stay in the hospital. Why is it a rush to, I would had preferred to be home, but why is it and they even asked me after I lost if I wanted to go home and
Wow.
give birth at home. They was like, it's not necessary that you stay. And I'm like, I'm kind of confused. Like, I just had no education about this at all.
Right.
So yeah, that was the process.
Gotcha. Okay, well, keep going to this next beautiful pregnancy and how you got from where you were to 6 months later to say, yes, we'll try again.
Well, we never really said we would try again. I guess there was just not a preventative method. So it just naturally happened. So Jonah and Nova's expected delivery date were a day apart. So Jonah's was January the 22nd, Nova's was January the 23rd. And while it is such a beautiful moment, it caused a lot of anxiety for me. Every single week was the same exact week, and so I still had no idea what had happened with Jonah. So I was very anxious about Nova. I was going to a provider it was a different provider. She was a female provider. She wasn't Black, but she was of another ethnicity. And she was also very dismissive. She was dismissive. She would talk to my husband more than she would speak with me. She would kind of make a mockery out of some of the questions that I would ask. She was very short. It just almost seemed like she kind of took my pregnancy as a joke. And so at 30 weeks, I decided, no more. And what was the deciding factor for that was she told me one day at a doctor's visit, just a well checkup, she told me that because of my stature, that I was going to be more likely to have a C-section. And so we needed to start planning that process. And so I was like, well, I know people personally that are much smaller than me and shorter than I am, and they've given birth to 10-pound babies. And so she was like, no, that's more of a risk. And she asked me about my moms and my mom and my sisters and what, if they had children and how did they deliver. And I had shared that they had cesarean sections, but they probably lacked resources, knowledge, and education. And they probably had providers like you who kind of
Yes.
just pushed that concept on them. And so she and I did not see eye to eye. I did not feel comfortable with her. And so I was on search for another provider who I
Yes.
currently work very close knit with now. So she and I are, we send each other clients all the time. Her name is Dr. Nikenji Jackson. She's an OBGYN here in Savannah, Georgia, and she's amazing. And much like your response, hers was the same. Like, she had no idea. She was like, I'm not that good to be able to predict whether or not you have a C-section, but we will try the vaginal birth and we'll do the best that we can. And she was so attentive. I didn't know that I was diagnosed with like hypertension. She never shared, the provider before Dr. Jackson, she never shared that information with me, but it was in my notes that I had like high blood pressure. And I've never struggled with high blood pressure, but she never shared that information with me. So she also she didn't deem me as high risk. So when I met with Dr. Jackson, they did deem me as high risk. One was because of my loss that I had experienced with Jonah, and also because of the hypertension and being a woman of color. And so I was able to see a high risk OBGYN, Dr. Keisha Reddick, who I also work close knit with. And she was Dr. Jackson and Dr. Reddick were awesome. They both are providers of color. But she was able to sit down and I was able to share with her my experience, and she wanted to do further testing to see what could have possibly been the cause of me losing Jonah. And so anyways, Dr. Jackson, she was the best OBGYN. She literally was like, if you feel comfortable with coming in 3 times a week just so that you can feel safe, I'm okay with that. Like, you can come in every day if you wanted to. And so she was awesome. They did take Nova a little bit early at 38 weeks because of my anxiety. So I did do an induction, and I was aware that she wasn't ready, and I knew that I would possibly have a C-section. I didn't want to have one, but I knew that if it came down to it, I was going to make sure my child was healthy. So Dr. Jackson, she came in and she did every induction method. We did the Foley ball, we did the Pitocin, we did the Cervidil, we did all methods. She was very patient. She was not in a rush. She even asked me, she was like, hey, you can go home if you want to, and you can wait it out a little bit and you can come back. And, I just felt like another provider would have never shared that information. They would have wanted to do a C-section right away. And she was not big on that at all. She was okay with me just waiting. I did have to end up having a C-section, and she did explain to me why, and I felt comfortable with her doing it, although it was kind of traumatic. I had just been through all the methods. My last try was the last induction method was the Pitocin. I had just gotten like the epidural. So she was so gentle, and she called me on the phone and she said, hey, you're strong and you've tried everything for your baby, and she said, right now her heart rate is dropping and we have to get her out now. And I'm on the way up there now. And so she was absolutely amazing. She still is amazing. She was so knowledgeable. She was so gentle with me. She treated me like I was a part of. It was just an amazing experience. And I transitioned OBGYNs at 30 weeks. So I wasn't going to allow that last provider to give I wasn't going to allow her to do anything further with me. I didn't want her to maintain my treatment.
Girl, Jessica, I know you. Go ahead, Jessica, because I'm so proud of you, Tabria. Go ahead, Jessica.
Yes, and I've spoken with moms a lot who have had concerns and they were brushed off, and then they later in their pregnancy, 30 weeks, 27 weeks, whatever, they go and get a new provider and they have a better experience, whether or not the provider is a provider of color or not. It's just someone who will listen to you and someone who will allow you to be a part of your birth experience, because with Jonah is almost like it was your body was the vessel for it all, but everything was happening around you, and you had like no control of it. And they also didn't tell you what was going on. And oh my gosh, that is so good that the second OBGYN was able to refer you to like a high risk OB, because that should have been off top, especially just because of your history and them not even knowing for sure how that even happened. But the difference from those providers, for people who are listening and thinking about maybe switching providers in their pregnancy, is that you were an inquisitive patient. If you're someone who's had a history like you did and you have some anxiety, you have questions. And a lot of times for providers, they don't like a lot of questions, especially questions that they don't know the answer to.
Sure.
And when they don't know the answer to it, they make you feel stupid for asking the question because they feel stupid on the inside because they don't know the answer.
Sure.
But you went to another OB and, to ask her about the C-section question. And she was just like, I don't know if you'll have one. Maybe you will, maybe you're not. And that's the answer. Like sometimes the answer to a patient's question is, I don't know. And that doesn't mean you're dumb. That's just what it is.
They
And
really
I
don't
would
know.
like somebody to tell me they don't know than to make me sound stupid for asking the question, or to tell me a lie, or to be rude to me. That's a huge. It seems small, but that matters so much. If you have a provider that's willing to tell you, I don't know, but I'll refer you to a specialist. I don't know, but I'll try to find the answer. That's so
I don't know, but you can come every day. Look, if you don't watch my baby every day, I'm coming to you.
She was absolutely amazing. Like from the moment that she came in, I mean, her and her nurse practitioner, her name is Gwen. She also came in and they sat with me for hours. And they were just like, what other questions do you have? Like, we want to make you feel like this is we want that other experience to not, we don't want your next birth experience to be like that. And I mean, even though it didn't necessarily go as I had planned it to go, it was way better than before. And I mean, I delivered a happy, healthy, beautiful, active baby girl. And Jonah and Nova, they were my driving forces to do the work that I do today with moms. So
Yes. Now, a lot of moms are fearful of swapping providers at 30 weeks. So some of them say, yes, I'm not dealing with this. Even if I can't explain what it is, it doesn't feel right. So I'm just going to swap. But other people at 30 weeks are fearful of doing it. Was it a hard transition, or was it easy to get your information from one provider to the next?
Well, it was not the easiest because I wanted a provider of color. And in this area, there were not many of them. I wanted to be under the treatment of someone that I felt comfortable with. I was not comfortable with men because of the experience that I had with my first male OBGYN. And then I just wanted someone who I felt I could really relate to and be honest with and be able to build trust with. So it took me a couple of days before I was able to find someone. And I remember telling the person that answered the phone for Dr. Jackson's office, I said, you can tell her that I need her. And so she said, I'll be sure to transfer that message. And I said, just let her know that I have to see her and that I need her. And so that's just been that.
Wow. And then the only other thing I want to hit on, so moms understand this or listeners understand this, is that you had high blood pressure and did not know it. So
I had no idea.
And if you had continued on with that first provider, then you could have had the same thing happen with Nova that happened with Jonah, because high blood pressure complicates things and it makes it hard for the placenta to deliver the nutrients that the baby needs and for it to take the toxins away. And so when the baby's inside, it cannot continue on without the placenta doing what it's supposed to do. And high blood pressure makes that very difficult. So God literally sent an angel your way, because that identification of that and keeping down your anxiety and whatever else it was that you were doing to keep your blood pressure down, I truly believe made all the difference.
Mm-hmm. And another issue that would not have been caught was my amniotic fluid was low. And I suspect that is what happened with Jonah. I was not consuming enough water, and I thought I was because that's all I really drink is water. But I guess it just wasn't enough. I needed to drink like twice as much as water as I was drinking. And I was able to, so through my weekly visits, they would do ultrasounds every week. And they noticed that my amniotic fluid was low. And the doctor at that time, because I would see Dr. Jackson and another doctor named Dr. Terreo, who he was a male, but it was different. I felt comfortable with him. And he said that you need to increase your fluid by drinking double the water that you drink. He said, because you can't let it get as low as this number, or we will have to take the baby because she won't have enough fluid to be able to, for her cord to flow as it should.
Yeah, so it keeps the pressure for our listeners. The amniotic fluid keeps the pressure off of the umbilical cord so that oxygen can flow in and blood can flow in and the toxins can flow out. And so for the first half of the pregnancy, how much water the mom consumes sets the amount of fluid that's in there. And then following that time period, then the baby's urine is what's keeping it, keeping that fluid level up. And so you have to continue to drink water so that you can help anything that's not happening, on the inside. So I'm so happy you brought that up because people don't understand the importance of amniotic fluid. And if they did, then they would drink more water. I really believe that. So thank you, Tabria.
And ACOG, I just want to say this. I think ACOG's recommendation is like over 64 ounces a day. So that's like 4 bottles, like regular standard bottles of water a day. So over that. So like 64 to like 86.
Yes. And then we always recommend that as the mom grows, she drinks more water because we're supposed to have half our body weight in fluid in ounces per day. And so if so we can't just say one set number, we have to figure out what is the mom's weight and then how much more does she need to increase to keep her body going the way it needs to go. So please keep going, Tabria.
I suspect that was the issue with Jonah, because when your amniotic fluid is low, the cord cannot move as freely. And so what the OBGYN that was treating Jonah mentioned was that it was a cord accident. But he never mentioned anything about my amniotic fluid. So when I delivered Jonah, there was the cord that was wrapped around his neck, cord that was wrapped around his wrist, and cords that was wrapped around his ankles. And so no one ever educated me. And I wholeheartedly believe, and I didn't want to get, and I think, I wanted to get my medical records. I never got them, but I wholeheartedly believe if I were to get my medical records, it would probably say that my amniotic fluid was low. No one ever mentioned that to me. No one shared the importance of that until I had gotten to Dr. Jackson's doctor's office. And that's when Dr. Terreo said, you need to increase your fluids. And I did. And I came back the next week and he was like, what did you do? And I was like, well, I took it serious. I don't want to.
You saved your baby girl.
Yeah. So I suspect that because we never found out what the issue was with me and Jonah. But I suspect that it was the amniotic fluid.
Well, too, I know that they may have explained this to you too. Our kidneys are responsible for keeping our blood pressure regulated. And if we're dehydrated, a signal is sent to the brain to increase the blood pressure because we want to make sure that the body's still good. So that's the body's natural response, pregnant or not, is to increase blood pressure if we're dehydrated. And so the fluid intake, I say all that to say the fluid intake is so important, especially in us, because we're the ones running into high blood pressure during pregnancy. So, oh my gosh, thank you for sharing that.
Yeah, of course.
Okay, so tell us, what is it that you do for moms? Because I know we're wrapping up, but tell us, what do you do day to day to pour into moms?
Sure. Well, like I mentioned before, I am the therapist and the founder of Compassionate Counseling and Support Services. I'm trained in perinatal mental health, and I treat women of color. And so a lot of moms will, like currently right now on my caseload, I have moms who've experienced loss, moms who have had successful IVF. I have moms who are currently pregnant, who recently had a baby, who has postpartum OCD, postpartum depression, postpartum anxiety. And so, what my role is to provide emotional and psychological support for those moms. I also am really big on on making sure that I connect them to resources, which is why I'm so happy that I found you all, because even if we aren't able to do anything in person, maybe host something virtual so that I can connect moms to you all, because a lot of them have no idea about pelvic floor specialists or, whatever. But I work on postpartum care plans with those moms. I educate them on perinatal mood and anxiety disorders, because most of the time, no one's ever heard, even some providers have never heard of uh, perinatal mood and anxiety disorders. So just educating them on the signs to watch out for during pregnancy or after pregnancy. I do a lot of the administering, like the testing, just to make sure that they, if they do have postpartum depression or struggling with postpartum issues in general, that I'm able to like track that and monitor that. If they have just recently had a baby, a month after, 3 months after, and 6 months after. So I make sure that I use the Edinburgh postnatal assessment and track that, their responses. And yeah, so that's pretty much what I do, on top of, helping them kind of create coping skills and just a safe space to an outlet to be able to express how they're feeling. Sometimes a mom doesn't have to experience a loss to be grieving who she thought she would be as a mother, or what she thought motherhood would look like. And so that's a little bit about the type of therapy that I offer.
Wow. That's a lot. That's a
Mm-hmm.
lot. And it's a lot of support that's not offered. And like you said, that a lot of moms don't know about. And so for us, it's important to us too. That's why we created this podcast, so that we could have people like you on it and tell people exactly what they need. So when we have someone who, like we had last week, someone contacted us and they had just lost babies. And it's like they know anybody who's gone through that. And then they don't know where to go to find the support for it. So then we connect them with people like you who do this, because there's not a lack of help out there. It's a lack of, like you said, knowledge that there is help out there. And both are bad.
Yep.
Both situations are bad situations to
Mm-hmm.
be in. So yes, thank you. Jessica, did you have anything else for this precious woman that you wanted to ask?
With your counseling services, you service people in Georgia and Florida?
I do.
Okay, just
Georgia
those
and Florida. Just those two states for now.
Okay.
Yes.
I'm just thinking of people I want to refer to you. So do you do virtual services?
I only offer virtual services at this time. So that is the only way that we would be able to connect currently.
That is so wonderful. Do you know what we're finding? The reason that we get so excited when people talk about virtual services is that the way traditional healthcare is done does not cater to a woman postpartum. And you know that. And I mean, we all know that, but nobody's changing it. But now everybody's changing it, because the ones who care, the ones who know that a mom leaving her house that first week is hard. And she's trying to take her baby to the doctor. Then 6 weeks later will go check on herself. Well, what happens between postpartum day 1 and 6 weeks? She has no support unless she drives out to go get it. So no more, because we watch and we can see how, just using a smart device, how moms are stressed in the car. Moms cannot recover. They can't get quality sleep. Like, you're not sleeping at night, but you're running around during the day. So you don't want to choose between your mental health and your physical health. You don't want to choose between taking care of your baby and taking care of yourself. And so now providers like you are saying, you don't have to choose. I can be there for you without you even having to leave your house, because every child is going to take a nap. And so
Yep.
then we could do our virtual session, get what we need, and then go back to our children and back to our households whole, as opposed to, like you said, having those signs and ignoring the signs that something is there. And as providers, we're able to pick up on those signs and then refer them to people like you. So this is
Yeah.
wonderful, Tabria.
And to add to that, I encourage moms to have their children in the sessions. I think that just depending on the conversation, it can be healthy. I also encourage babies. So a lot of times my moms are nursing or changing diapers or, putting their babies to sleep in sessions. And I always encourage them, if you ever had to choose between putting your baby down for a nap and mental health, I never want you to choose that. Like, come to your sessions, bring your baby, change diapers. You can take a break. I'm okay with crying. Like, I know, I've had a baby and I know what that feels like. So bring them. So I encourage my moms to bring their babies and have their children in session. I don't mind that at all.
I love that because that's really decreasing the barriers, because a lot of times women don't seek the care that they need, whether it's pelvic floor PT or counseling services, because of the hassle of trying to get to those appointments, especially if they have to take their kids. People get embarrassed if babies are crying and stuff like that. So thank you for eliminating those barriers. And I want to ask you this. I know we have to wrap up, but I feel like, just like I believe that women should go ahead and schedule like a postpartum like screen for pelvic floor issues after a baby, I feel like they should schedule like a screening or a session for like counseling services and mental health issues as well. Or do you promote that?
Yeah, I do. A lot of times when I have moms who are pregnant, we create postpartum care plans in the sessions. And so, or I'll either, and if we don't have time, like if they want to use their sessions for processing or, whatever, then I'll assign it for therapy homework. And that is a part of the postpartum care planning. Like, okay, so how are we going to make this work whenever you have the baby? You're going to be tired. This is going to be new for you. It's going to be a huge transition. What time do we need to meet? And so, I make sure that I check in on them, even if it's not during a session, just checking in. Hey, how are you doing? How are you feeling? Just wanted to let you know that if you need support sooner than our scheduled appointment, that I'm here. So most definitely, I encourage that, and I think that that's necessary. A lot of times, a lot of moms go ahead and do a lot of preventative services. So they're like, well, I know how I am. I know that I'm easy to get into a down mood. Should I go ahead and seek out medication or seek out a psychiatrist? And I encourage that. And so, if you feel like you are more susceptible to postpartum depression and that, this transition or adjustment is going to be difficult, then yes, let's go ahead and get services set up for that. So, that the going ahead and setting a therapy appointment is a preventative service. And so, I encourage it. I support it. And I want to see your face in postpartum, because it is a lot. It is my postpartum moms that I struggle with keeping consistency in therapy because of the barriers that they have with, maybe not having the best support or like a lack of sleep or like feeling like they don't want to have their baby in the session. And so I try to make it as comfortable as possible. I want the atmosphere to be baby friendly, and I want you to get what you need and still be able to do what you need to do as a mom at the same time.
Wow. Well, I know our listeners don't want to find you. So where are you? How can they find you? Of course, we're going to be pointing them your way anyway, but please share.
Sure. Well, again, my practice is compassionate counseling and support services. My website is www.compassionatecounselingllc.net. My email address is hello@compassionatecounseling.sprucecare.com. My contact number is 912-325-9855. You can also find me on Therapy for Black Girls directory and Psychology Today directory. So if you're ever seeking services or know someone that could benefit from these services, then that is my contact information.
Wow.
Thank you so much for talking to us today. And I love the name of your practice, and that is compassionate, because that's what we're missing so much in healthcare. I feel like that's what you missed the first time, and that's what you were gifted with the second time. And that's what we hope, especially in Operation Miss, that all of our Miss moms and every mom has compassion throughout their birth experience and beyond. Thank you, Tabria.
Thank you so much for having me. And I appreciate the both of you for what you do to serve moms and babies. And it's just beautiful. And I'm hoping that I can connect some of my moms with you all, and that, you're able to support them as well. So thank you all so much.
Thank you. We love you, Tabria.